So this is Chiro Kids, and basically it's all about chiropractic care for children. Chiropractors have been caring for children for over 100 years. Many different common childhood ailments can respond to chiropractic care because it is a natural form of healthcare. Normally, the way that it works is that parents will become chiropractic patients, and then they, in turn, see the benefits of chiropractic care, and then they bring their kids in order to be adjusted. So, chiropractic care is drug-free. We use a holistic approach. We use spinal manipulation in order to help make sure that the child is as healthy as they can be. There is a major relationship between the way that the spine works and the way that the nervous system works. And basically, the general idea in chiropractic is that, and this is again talking on a very like layperson type of level. You can get very much into the research and other kinds of things when it comes to chiropractic care. But the best kind of way to look at it is that there typically is a problem where there's some kind of dysfunction in the movement of the spine or in the joints. And that dysfunction in the spine or the movements in the joints can cause problems within the nervous system. Those problems within the nervous system can have multiple different effects on the body's health. Basically, this is the thing that chiropractors are trained to evaluate and treat and adjust in order to help get rid of those spinal problems. So some things that might be an example of a child that might need to look at getting adjusted, or a parent to bring a child in, would be maybe if the child is favoring turning their head to one side over the other. So if they're always laying down and turning the head to the left, or if they're always turning their body to the left and they never really turn to the right when they're crawling, those can all be different things that can show problems. Again, the idea is that you want to help to determine any kind of imbalance or asymmetries that there might be within the muscular system, and then try to address it as early as you can. And again, the idea is that there's a link between the central nervous system and a variety of childhood problems. There has been links, and these are anecdotal links, but there have been links to chiropractic being able to help children that have issues with ear infections, difficulty breathing like asthma, colic, attention deficit disorder, and things along those lines. So the idea is that the body doesn't necessarily view the world properly, and by adjusting, you can basically help to reset the nervous system so that a person's nervous system works better so that they can actually interact better with their world. Basically, there's a multitude of things to do. So let's talk a little bit about actually me. So the question that you can get with some of these things is that why does it matter, and why should you actually, like, of all people, why am I talking about any of this stuff? And basically there's a multitude of different certifications that I have that basically helps to give me some expertise among these. So one of those is that I'm actually one of the few people, especially one of the few people, if the only one in the Toledo area, that is certified as a board certified functional neurologist. What that means is that I've had over 900 hours in diagnosis and the treatment of neurological disorders. That beyond that, I've also had specialized types of training on issues for children that have neurobehavioral disorders of childhood. So that would include things like ADHD, Tourette's, dyslexia, autism, and the different variations on the autism spectrum disorder. So there's a handful of different things with that, and we can get into that a little bit later. But the other thing is that I'm also a certified chiropractic sports physician. So when it comes to the issues related to the issues with concussion or other kinds of problems that kids can have from repetitive stress disorders in sports or any of that other kind of stuff, having that specialty in sports medicine is something that can definitely help out. So let's take a little bit more of a closer look at chiropractic care here. So again, kids get hurt. They, fall down and, get bumps and bruises and all that kind of stuff all the time. So again, while they're growing, again, there's multiple different, years of trauma, and there's stress and other kinds of stuff like that for children. And in fact, some people think that there can be extra pressure involved with, being in the fetal position or traveling through the birth canal and different stuff like that. So there's multiple different things with there. And so, there are multiple different kids, especially kids of chiropractors, that get adjusted within hours of being born, or minutes in some cases. Um, so basically what it comes down to, though, is that there is, and this is one of those kind of things where I want to be careful with what I'm saying, because I don't want to overstate what chiropractic can do. I don't think that it's going to be a panacea that's going to be able to fix every type of problem in the world, but there are loads of different reports from chiropractors and chiropractic patients of the different things that it can help. And what that means is that those are called anecdotal reports, which means that there's not a lot of data on these kind of things. If you can think about it, there's not going to be a lot of studies with parents that are going to be subjecting their kids to an experiment where one kid might be getting a treatment that's a real treatment or a fake treatment, and then trying to figure out which is which. So this has been a hard thing to go through from the standpoint of like hard research, but there are tons and tons of anecdotal reports of chiropractic being able to help with a multitude of conditions. And some of those conditions would be colic. That is a huge one. Again, with a younger child and an infant having acid reflux, problems with breastfeeding or latching difficulties, sleep disturbances, having allergic reactions, or even having chronic infections. So there's a multitude of different things that are anecdotal reports that chiropractic might be able to help with. When it comes to, you know, again, kids and toddlers, again, they have frequent falls. There's also sports injuries that can be involved in that, or with that, playground bumps and bruises. Again, having a heavy school bag where it's too heavy for the child themselves, sitting all day in the classroom, and all of those are going to be different types of stresses to the child's spine and eventually to their nervous system. So there's multiple different ways that a chiropractor can actually treat a child, again, and it's not all that different from an adult. First of all, like, you have to do a history of the child. You have to find out about the child's health. Typically, you also have to find out about the birth history. And then obviously you need to discuss with the observations and the complaints that the child might have, or the observations and the complaints that a parent might have based on what's going on. Again, it depends on the age of the child and whether or not they can actually complain of whether or not they have pain or a problem. Again, obviously, a 3-month-old infant isn't going to be complaining of pain, but obviously a parent would know whether or not they're being more fussy than normal, or whether or not things have changed, or whatever, however that works. So basically what would happen is that, after going through and doing the history, a chiropractor is going to need to go through and perform a physical examination. So you go through and you check the child's spine and you check the nervous system. And any normal chiropractor would typically stop there. Again, I also have the ability to go through and check a multitude of other things with the nervous system to see whether or not the person is, whether or not the child has issues with delayed reflexes, or a persistence of primitive reflexes, or we're looking at problems with not being able to hit milestones on time, or different things like that. So those would be things that I would look at that might be a little bit different than a typical like pediatric chiropractor. So again, chiropractors are going to be trained to evaluate these pediatric kind of spinal problems in order to try to help adjust the child gently and make sure that they stay at ease, and then obviously to get things helped. So when it comes down to it, again, spinal adjustments for children, and infants, it isn't necessarily the same as the adjustment that you would get for an adult. It would be similar, but not exactly the same, because often with a child, you're not going to be using like full-on types of like big movements that happen. A lot of times just little fingertip type of pressures in order to actually get things to move is all you need, because they haven't had years of wear and tear on their spine to cause problems. So again, the amount of force is often typically not more than a finger touch. And again, that can usually help to restore the mobility in those spinal joints that have become locked or a little bit stiff over time. And because of all that, because you're not having like a huge amount of movement that you're trying to do, because again, you're talking about a child that, you don't need to do like you would for somebody who's 50 years old and has a whole lot of arthritis. Because with a lot of that, a lot of times you don't actually hear a popping sound when you do an adjustment on a child. You can hear it obviously on adults, you can hear it on kids sometimes, but again, it often for children, when it's done properly, you don't actually get any type of actual like cavitation that happens. So, basically, again, there's a whole load of different things that can apply with, how chiropractic can help kids. So again, the other thing about the care is that typically when it comes to getting treated is that, the chiropractic care for kids is typically going to be completely painless for the kids. Again, while an injury that might be painful is, if a kid is, has an injury that is painful, again, they might be sensitive to touch. Typically, getting adjusted is going to allow that area to heal up a little bit more effectively. Most of the time, kids enjoy getting adjusted. They enjoy their visit. And basically, within a few adjustments, you can get everything functioning normally. The thing about kids is that they bounce back really, really quick. When kids typically don't need to be adjusted as often as what adults do in order to help to restore the function back to where it should be. So the other thing about that is that, when it comes to the discomfort and stuff, there have been studies that have shown that, out of like 10,000 different visits, that only a few children had a little bit more discomfort, or maybe they had some fussiness, again, depending on their age, after they ended up getting adjusted. So the majority of the children had no adverse reactions to getting adjusted. So that type of data, basically helps to support chiropractic care for children as one of the safest types of healthcare available. Again, you're not loading the kid up with medications. You're not doing a whole bunch of different things in order to change the chemistry of the child. So lots of different parents will bring their kids in order to help get checked up regularly by a chiropractor as part of a healthy type of lifestyle. And again, that's one of the things with getting adjusted, is that getting adjusted itself also stimulates the nervous system, so that can help them to develop into their full potential. So again, chiropractic care is safe, it's gentle, and it's an effective way to help to basically reset the nervous system and allow a child to basically express wellness, to the fullest potential. So there's multiple different things that happens with that. But again, kids, in that first year, they're typically going to end up getting a lot of growth in the spine. So the spine can actually lengthen by up to 50% within the first year. So again, you don't have the 50% growth at any other time in your life. So you have to make sure that there's proper alignment and there's not alterations in tone of one side to another. Because basically what happens is that there ends up being laws, and laws in physics, but it's really like laws in anatomy, that bones will change shape depends on the pressure that's placed on it. So over time, again, if you're talking about braces, and when you tighten up a brace, how it's going to be basically dragging from one place to another, bone disappears from one side of the tooth on one side, and then it reappears on the other side. So over time, you can actually shift where the tooth is in the jaw itself. Anything over time, if you keep applying pressure to it, you can end up moving the bone. And over time, you can end up causing changes in the shapes of the bone and other kinds of problems. So again, if a child ends up having an issue where there's a lack of alignment, or if there's a lack of balance in the spine, then, again, going back to the kid that can only really turn their head very well one way, then that can end up changing how the facets actually work, or that can change how the And that can basically lead to problems over time that end up becoming more permanent, because that compression forces over time would change the way that the bone develops, and it can develop more asymmetrical. So also in the first year of life, again, you also end up having a lot of development of the spinal curves. Again, you go from basically being flat and a blob that doesn't really move, right? Doesn't really, and then the baby starts to move around, starts to actually be able to lift its head up, starts to actually engage the muscles for the neck, for the trunk, and kind of go from there. So in the process of doing all that, it starts to develop the normal curves that are supposed to be there in the neck, the ones that are supposed to be there in the upper back, and the one that's supposed to be there in the low back. So all of those things end up being necessary for proper movement, proper balance, having correct upright posture, being able to protect the spine, and then shock absorption when all those are aligned properly. So central nervous system is going to end up having the brain and the spinal cord. Again, that nervous system is going to process everything that the body does. So movement, heartbeat, when you see a baby smile, or if a baby sees another baby smile, and feeling the sun on your skin, laughing, all of that stuff ends up being coordinated by the brain and the spinal cord. In infants, the central nervous system is also going to help to control the growth and development. Again, there's obviously hormones and other stuff that's going to be involved, but the greatest time of brain development is going to happen in infancy, and we are also developing proprioception at that time. And what proprioception is that it's knowing where your body is in space. People typically talk about how there's 5 senses, but that's not true. There's a bunch of senses when it comes to balance in the vestibular, like the inner ear, and knowing where you are when it comes to balance. There's other kinds of stuff like proprioception, which is knowing where your body is in space. So you can test proprioception on an adult typically by taking a finger, grabbing the finger, and moving the finger down, down, up, down, however it is that you do it in testing, to have the person that you're testing know whether or not you're moving it. You can do it grossly by having somebody get into a position. So the classic kind of thing that I show people is if you put one side of the body in a position, so if you do something like this, then what should happen is that if the person's eyes are closed and you put their hand in a position like that, they should be able to replicate that position on the other side of the body without being too skewed one way or another, or having something off or anything like that. So that's the idea of proprioception. So you end up having the brain that's developing, you're learning the sense of proprioception and developing that. And again, infancy is the time where all of that stuff is developing, and you're developing that motor system, which is important. You have to make sure that you develop a good motor system in order to hit the other proper milestones as the child ages. So chiropractic care for a child, again, it can start with babies, but it can, you can have chiropractic care not only for babies, but through, like adolescents, teenagers, all that other kind of stuff, obviously all the way up through adults. And it obviously helps to promote overall health and well-being. So you can help make a child healthier. You can help them encourage them to be more active. Again, somebody that's moving and doing that generally is happier than someone who's stuck in one space all the time. Again, try to help to eliminate some of the major stressors that you have on the nervous system. And you can also improve physical health and mental concentration at the same time. So there's a bunch of different things that are there. Now, some of these things that we talk about, again, some of it is talking about it at a kind of like a different level, like, that you adjust a kid, and because you adjust the kid, they can move more, they can move freer, there's more balance within the system, so that they're less likely to get injured, or they're more likely to develop their brain and different kind of stuff like that. One of them that's actually there that's something that can be helpful is changes with issues with breathing difficulties. So with something like asthma, there's issues that you can do, and again, this can help adults that have asthma as well, but there's issues that you can have with asthma that can change how well a person can breathe, obviously. So there's different stuff that happens with asthma. For example, the idea of the bronchioles constricting and there being inflammation and swelling and stuff like that, I would never tell anybody that me doing an adjustment on somebody is going to change the amount of inflammation that is going to be present in someone's bronchi. But that being said, While you're not necessarily going to change that, or you're not going to necessarily exactly change the amount of spasm that happen within the bronchi during an asthma attack, one of the things that you can have a major effect on is the mobility of the thoracic spine and the rib cage in general. So doing adjustments to a child's upper back is going to be able to improve the amount of extension that you would have, as opposed to having the flexion there, the extension that's going to end up happening up here in that thoracic spine. So by doing an adjustment there, you're actually going to be able to improve that movement. And by improving the movement of the thoracic spine into thoracic extension, doing the rotation in the spine and the ribs, because there's joints that are in the front of the ribs and there's joints that are in the back. By improving the movement of all of that, it makes it easier for kids to breathe. And truthfully, this is one of those kind of things where I know plenty of chiropractors that the reason why they became a chiropractor was because they had asthma when they were a child. And when they went to the chiropractor, they started getting adjusted, and it helped their asthma get less, and so that it affect their lives less. And then over time, then the asthma went away. Right. So again, that's not saying that I'm going to treat asthma and I'm going to make asthma go away specifically, but it is one of those kind of things where you can have an impact on a different kind of a disease process, other than just the, again, the drug way to do it, to have to take an inhaler and have that all the time. Again, that's not saying that somebody would need to get rid of their inhaler if they're getting adjusted. That wouldn't be something I would ever recommend, but you can end up improving the way that the system works. So again, a whole host of different things: asthma, some allergies, again, bronchitis, other types of breathing problems can be affected from that, if you have the child get adjusted. So posture, that's another huge thing that can be there. Again, as opposed to having that slumped kind of posture that is basically prevalent all the time now, you can end up promoting good posture by making sure that, again, working on exercises for that. Again, even with a child, you can end up getting them to sit upright and change the way that they sit. But you can go through and just by adjusting the spine, that can help to improve their posture. I have seen some crazy things with posture over the years, where you end up having somebody that has had Parkinson's, or they have some other kind of issue with a stroke or something like that, where they first start coming into you and they don't have the ability to stand up as well, because in those people, it's twofold. They have arthritis that's holding them back, but at the same time, their brain isn't really turned on as well as what it could be. So if the light isn't on quite as bright as what it could be, then they end up having the tendency to be leaned forward in that poor kind of stooped kind of posture. And I've seen people that, after continually getting adjusted, working on exercises, going from having that stooped posture to walking upright in, basically the limit that they have of that spine to actually like straighten out. So posture is a huge thing. Again, the spine is going to be the structure on the body and how everything is built off of that. So you have to make sure that you end up having those good postural type of habits and start them early in life and end up trying to continue. Again, there's so many different things that can cause trauma to the spine. One of them is time, and one of them is just continuing to engage in that poor posture. So again, like we talked about it a little bit before, again, the healthy brain and the nerve development, again, helping to get a child or an infant, having them get adjusted on a regular basis can affect a whole host of things, whether or not it's breathing, digestion, again, thinking just in general, the sense of touch, playing, and anything that ends up affecting or changing any of that can, impair their ability to function. And you don't want to do that. So by getting adjusted, the adjustment is a major stimulus to the brain, because again, you're using that proprioception thing in order to fire up into the brain. So by doing an adjustment and stretching out the joint, you're stretching the muscles around it, you're stretching the little itty bitty like receptors that happen within the joint, and those receptors are going to fire up to the brain, and it's going to make the brain work a little bit better. So that's another way that you can end up having stimulation of the spine. You can also get stimulation of the digestive system. without going into a big talk about it right now, you have the sympathetic nervous system and the parasympathetic nervous system. The parasympathetic nervous system is going to be rest and digest. So it's going to be, processing things and actually like, the state that the body should be in on a regular basis. So the sympathetic nervous system is going to end up having to do with the fight or flight reaction. And that it basically is, somebody that's associated with anxiety. It's associated with like a lot of negative things. It is a good thing to have, but it is something that you don't want to be overwhelming for a person. So one of the things that happen is that with pain is that sometimes that sympathetic nervous system can be firing too much. And if it's firing too much, it's the opposite of the rest and digest. It actually makes it so that too much pain will promote poor digestion. So things don't get digested as well as what they should. The other end of the spectrum though too is that again, if the brain is functioning well, when the brain functions well, it makes it so that you're more often in the rest or digest mode. When the brain isn't functioning as well as what it should, anxiety pumps up, you end up having more issues with other types of problems. So if you end up having a lot of issues with the brain not working well, the digestive function doesn't happen quite as easily. So, and again, that you can get way more scientific and everything on that, but we don't really have time during this lecture. So again, the nervous system is going to control digestive function in different regions, including down in the lumbar region, including down in the low back, using those sympathetic nerves. And again, there's a sacral parasympathetic area. So you have an area that's up here in the brain that's going to do parasympathetics or rest and digest. And then there's another area that's down lower in basically the sacral region of the spinal cord that is going to basically help to stimulate the rest and digest function of the gut for the most part. So the lower half of the gut is going to end up being stimulated by that. So again, there's all kinds of different interplay that happens between them. But again, by making sure that you are making the brain work well, you basically help to realign or reset the nervous system or stimulate the nervous system to allow the body to digest more properly. Another thing that can happen is that when it comes to a child's immune system, there are multiple different things that happen with getting adjusted that have an effect on the immune system. Now, again, I realize that for many of you, that sounds like it's kind of an out there kind of a thing. But the brain and the nervous system itself controls everything in the body. And when it controls everything in the body, one of the things that it does is it control the immune system. You can end up getting imbalances in the immune system, just like you can end up getting imbalances in any other type of disease process, right? So if somebody has a problem with the amount of insulin that they're producing or how the body is reacting to insulin, that's obviously diabetes. That is a imbalance within the hormone system as when it's related to sugar. So the idea of having a problem that is a dysfunction of the immune system, where either it's not really responding as much as what it should be, and it has a low response, and then allows someone to get sick and then have symptoms, or maybe to the other end of the spectrum, where you end up having a higher response than what it should have, and then you can end up having other issues that are related to maybe a autoimmune type of a disease or something along those lines. So again, by going through and having the nervous system adjusted and having the person's spine adjusted properly, you can have an effect on the immune system. I realize that does sound like it's a little bit of a leap. You can definitely make the connections, but it is something that's there. So this is a story that basically it happens on a regular basis. When people start getting sick over the winter, it's one of those kind of things where we tell them to keep coming in. Unless they have something that like is really, really bad that we don't want to catch, then okay, stay home, right? But when it comes down to it, if it's like a common cold or like if there's ear aches or other types of general illnesses, we still want them to come into the office. one of the things that ends up being an interesting kind of fact is that when you're in chiropractic school, you're trying to get a lot of practice when it comes to doing adjustments. So if I'm trying to get practice by doing an adjustment, then basically what I want to do is I want to go and adjust other students as much as I possibly can. Well, in order to get somebody else to let them adjust you, or let you adjust them, you would have to let them adjust you. So typically in chiropractic school, you're getting adjusted a lot. You're actually getting adjusted way more than what you typically need to be, and typically by somebody who isn't necessarily as good, who is somebody who's been out for 5 years, 10 years, and it has seen a whole bunch of other kinds of stuff and has had a whole lot more practice. So chiropractic students, it's a really kind of common thing for chiropractic students to actually get sick because they end up getting adjusted too much. So it's kind of like a Goldilocks and the Three Bears kind of a thing, from the standpoint of not getting adjusted has the tendency to make people sick and have like the recurrence of the common cold and stuff like that. Whereas you get adjusted too much and it's the same thing. You end up having the tendency to get sick. It's one of those that happens, and that is pretty much an experience that people have, like that chiropractors have all across the country, like when they were going through school. Behavioral problems. Again, this is one of those kind of things that I work with that is, some that do some work with that work with children, talk about how chiropractic can help. But beyond just doing an adjustment, adjustments can be fantastic with kids that have behavioral problems, but there's way more to it than that. And people typically do need to have more training. And that's one of those kind of things where, again, I've had a whole bunch of training when it comes to, specifically these neurobehavioral types of problems. So again, one of the things that you can do is doing adjustments in order to help to stimulate the brain, but there's a whole handful of primitive reflexes that can be persistent when they shouldn't be persistent, which is an entire other lecture that we could do. But by helping to teach the parent and the child what to do, you can actually teach them exercises in order to make some of those things go away. And with a handful of other things, you can end up decreasing the number of behavioral problems that a child has. I have two students right now, two children. We'll just talk about one of them. One of the children is now in first grade, and last year obviously was in kindergarten. In kindergarten, the child was being sent down to the principal's office pretty much every day of kindergarten because of some type of behavior that they were having in the classroom. They started seeing me basically right at the start of the summer, maybe a little bit before school was out. And then over the course of a couple of months, now school has started back up. We're still doing stuff. The child is still progressing. But again, the impulsivity is down. The hyperactivity, still pretty hyperactive, but that's all right. That's what happens with a 6 or 7-year-old boy. But the behavior has dramatically changed to the point where the child this year has not been sent down to the principal one time. They haven't been sent down. They've started getting rewards. They're having, changes in the self-esteem and self-confidence. And again, that's a major change for how the child is going to do in school and progress and go from there, as opposed to the path that they were on. Mom is doing a fantastic job trying to help everything along. So there's multiple different things when it comes to those behavioral disorders. And you can even go, and there can be other problems when it comes to sleeping. Again, especially if there's tension in the neck, if there's tension in the back, if a child has headaches, if there's joint pain and other kinds of stuff, there can be problems with sleeping. And then even bedwetting can be something that you can actually have an impact on. There's other methods too, where it's not just like we're going to adjust the kid and that goes away, but that actually in and of itself, lots and lots of chiropractors have treated kids for, basically for bedwetting and had the bedwetting go away, as part of getting treated. Again, this isn't going to be something that I'm typically like advertising like on Facebook and stuff like that. That's one of the major kind of things that I can treat. But that is one of those kind of things that is a possibility. And there's other kinds of things, there's other kinds of techniques and stuff like that that parents may have not have been taught yet that you can try to do in order to help get the child to get better. So there's a whole handful of different things that are there. So when it comes to chiropractic care and colic, that is another kind of thing that is a big issue. So obviously when you're talking about colic is going to be excessive crying, which basically what that means is that it's crying for more than 3 hours a day and for more than 3 days a week, and it has to happen for over 3 weeks in order for it to be considered colic. Colic often is going to start between the 3rd and the 6th week after birth, and then it can go on up until a kid is around 3 to 4 months old. And the issue is that nobody knows exactly what causes colic. Nobody has a good solution for a child that ends up having colic. So the idea is that there's a whole bunch of different stuff that's out there that people try. The good thing is that colic is a temporary type of a problem. When it comes to the kids that are 3 years old, the ones that have it, up to 60% of them are going to resolve. By the time that they're 4 months old, 90% of them resolve. So there's multiple different things that are there. And again, theories involve that whole parasympathetic versus sympathetic type of stuff that we talked about before. So again, the crying bouts have the tendency to happen a little bit later in the day. And it's a weird kind of a thing where the normal stuff that would normally calm down crying from pain or hunger don't typically work. And it's something else that's weird that calms them down. And again, it could be a hair dryer, it could be static, it could be, any kind of other noise that might be doing it that might be able to help to calm them down. So there's a whole different handful of different things. But the thing that ends up being interesting is that it doesn't matter whether or not the child is a male or female. It doesn't matter whether or not the child is bottle fed or if they've been doing breastfeeding. It doesn't matter if the child was full term or preterm. It doesn't matter if it's the first or the second or any of the other kids after that, right? None of that affects the frequency of whether or not colic actually occurs. So it's normal when it comes to a kid for them to cry to maybe up to 2 hours a day. Again, there's going to be some kids are going to be more difficult than others. Some might be impossible to soothe, and it might not matter really what you do. But again, there's a difference between crying 2 hours a day and crying more often versus another kid who's basically like perfect, that never does anything, that never complains, cries, any of that other kind of stuff. Because everybody knows that there ends up being those two different ends of the spectrum when it comes to the kid. And again, that crying that a kid might do, it might get a little bit better after they pass gas or they have a bowel movement or stuff like that. But again, that we don't know what exactly causes colic. Nobody does. So, even though it can go away on its own, obviously there's a whole lot of stress for the parents and the child when the child has colic. And there's a couple of different studies that have been done on chiropractic that show that it has a positive impact on colic. So, when it comes to getting treated for, over a 2-week period of time, around 3 visits, 94% of babies that are adjusted by a chiropractor show a positive result, with up to 25% of those kids showing major improvement in just the first adjustment. There's another study where the authors concluded that chiropractic adjustments in the early stages of neurologic imprinting appear to safely and effectively address the craniocervical dysfunction and help to restore natural, efficient suckling patterns for infants who are unable to successfully latch. So again, there's different types of stuff when it comes to primitive reflexes maybe not working the way that they should. Again, the touching on the side of the cheek should encourage a child to turn their head and try to suckle or try to latch. So, there's multiple different things that can be associated with each of these. But again, chiropractic care and colic is one thing, are a couple of things that have the tendency to go together. Again, there's not a whole lot of research. There's way more anecdotal stuff, but every chiropractor has loads and loads of kids that have come in that have had issues with colic that have gotten better with having the kid be adjusted. So it's just one of those kind of things that just kind of is there. Again, we talked a little bit about, boosting the immune system and making sure that it works a little bit better. Again, for years, chiropractors have talked about how spinal adjustments can help improve an individual's overall health. Again, there's more research on that now, but really what it comes down to is that, if you adjust the nervous system or if you adjust the spine, that helps to reset the nervous system, make the nervous system work a little bit better. And by doing that, that has an impact on the way that the immune system works. So some studies show a decrease in the amount of antibiotics that are used among kids that receive chiropractic care. There was a study from out of Penn State University that was published that showed that kids that had childhood health problems were twice as likely to develop cancer or chronic lung disease by like a late middle age. Arthritis was 33% higher in those groups. So kids that have ill health may be apparent, and there might be there might be major issues with adult illnesses that come from that. So the idea is that when you get adjusted, the idea is that it helps to stimulate the immune system in order to help to combat infectious processes, and it helps kids that are sick get well and adults that are sick get well, but it also helps healthy people, whether or not they're children or whether or not they're adults, to stay healthier and to not get sick in the first place. So there's a whole bunch of different things that can cause issues with the immune system. So again, getting adjusted is going to be just one more thing. When it comes to antibiotics, again, antibiotics are another thing that is a reason to make sure that you are, getting adjusted and dealing with other things to help make it so that you don't need to take antibiotics. Again, one of the most common reasons that parents bring their kids to the chiropractor is for management of certain diseases that have the possibility of getting better or helped with chiropractic. Again, I'm not going to sit there and say that that a kid should not get antibiotics. That's not what I'm saying at all. I'm not saying that they should never get antibiotics, but there's a whole lot of kids who get antibiotics when they shouldn't. So the things about it is that 30% of the time when doctors prescribe medication or prescribe antibiotics for kids, the medications aren't needed, and that's according to the CDC. There's studies from the CDC that talk about the side effects from antibiotics. Again, there can be allergic reactions, and again, those allergic reactions are responsible for more than 65,000 children being sent to the emergency room every year. For kids that are younger than 5, there's side effects from antibiotics like amoxicillin or erythromycin. Again, there's multiple different causes for ER visits, and those, so like Z-Pak and other kinds of stuff, those can be big causes of kids having to go to the emergency room. So the other part of it is that when it comes to using those drugs is that using too much of it makes it so that it's not working. So we end up having these issues with the superbugs, where different strains of bacteria are going to be resistant to multiple different types of antibiotics. There is a growing number of infections that are going to be more virulent because of that. And again, because of that, it ends up being harder to treat. The resistance when it comes to antibiotics is going to be an urgent threat to public health. So again, every time that you're taking antibiotics when you don't need it, you have the possibility of helping to create more problems with those antibiotic bacteria. So again, this is not saying that a chiropractor should be used in place of antibiotics when a person has a problem. But in some cases, like when we'll talk a little bit later about ear infections, sometimes it's not a bad idea to actually, maybe get ingested instead. Or if there's been a couple of times, especially if the parent's been down that road and they've had a couple of different ear infections, maybe before having the surgery to place the tube, maybe it would make more sense in order to have them get adjusted on a regular basis. So again, allergies is something that some state that they can have an effect on, where it comes to they have more allergies, they start getting adjusted, and then the allergy starts to get better. Again, this is related to the whole idea of the relationship between the nervous system and the immune system. Again, someone who gets sick all the time is going to be at one end of the spectrum. Someone who has allergies basically has their immune system working overtime. So in somebody that's getting sick all the time, now you don't have your immune system working as well as what it should, whereas somebody who gets allergies has their immune system working more than it should. So there ends up needing to be a balance. Typically, people don't get sick all the time and get allergies. You can, that's a possibility, but typically that's the way that, you get adjusted, and by being adjusted and making sure that you're checked out on a semi-normal basis. Again, this is one of those kind of things that I don't push on patients. I don't tell them that they have to bring their kids in, but it is one of those kind of things that it has an effect on patients and on children. So, allergies is just one of those other kind of things. So when it comes to ear infections, like we were just talking about, ear infection is going to, again, be a very, very common childhood illness. Again, other than getting a cold, it's one of the most common, types of childhood illness that is there, especially for infants and younger children. So ear infections are going to be most frequent between the age of 3 months and 3 years, but they can be fairly common up until the age of 8. Again, 5 out of 6 children will get at least one ear infection before their 3rd birthday, and nearly 40% of children will have 3 or more ear infections before that age. So again, more than 40% are going to have more than 3 ear infections before they get to the age of 3, right? So that's at least 1 a year. That's a lot. That's a lot of ear infections. And again, the way the chiropractors look at it is that we try to take a holistic approach to it, but we're not trying to give medication, because the standard of care for the majority of these ear infections is that the majority of them are viral. They're not actually going to be something that antibiotics will help in the first place, which when we talk about the antibiotics thing, that ends up being obviously an issue, is that if you're going to the doctor to get antibiotics, there's pressure on the doctor to give antibiotics, and there's other kinds of issues that goes with it. Even if they're not, again, many doctors will be able to resist that and not give the antibiotics. But again, if you're given antibiotics and it's a viral problem, then it's not there. Now, the way that I look at it is that, again, I'm a parent. I've had, issues with my kids, having problems as well. I don't fault a parent for wanting to take care of their kid and to stop their kid suffering. I get that. But again, especially when you're talking about the first one, to me, that makes sense. If it's something that's repeating over and over and over again, for sure, in that kind of situation, the problem isn't a deficiency of antibiotics. The problem, probably there's something else that's there. So the idea is that if you can do something with maybe getting the child adjusted, maybe that could be something that might be able to slow down or stop the ear infections. So again, chiropractors treat ear infections by manipulating the neck. And when you manipulate the neck, it helps to drain the ear. And this is one of those kind of things where, like, sometimes people don't understand the connection between the two. And the idea is that when there's a spasm that happens in the external part of the neck that's up and through here, oftentimes spasms happen in the throat itself. So when you do an adjustment on the neck, and this happens with adults sometimes with allergies. I had a patient today that talks about every time that he gets adjusted, his sinuses open up and everything drains out, and he ends up having less problems, with allergies. So when you talk about, like, with the ear, again, if there's fluid buildup in the middle ear, when you do an adjustment, the adjustment helps to relax the muscles in the neck outside, but it also relaxes the muscles in the throat. And when it relaxes the muscles down here in the throat, it causes the relaxation of the muscles around the outside of the eustachian tube. That's the tube that goes in between your ear and the back of your throat, the one that pops when you yawn and stuff like that. And then it allows the fluids and other kinds of stuff to drain out of that eustachian tube from the middle ear and drain out of the eustachian tube and make it so that they end up not having a problem. and getting better over as a result. So when it comes down to it, again, how can you tell if your kid has an ear infection? Again, because the kid's not always going to be like, "Mama, I got an ear infection." Again, there's different signs that you can do. Again, the tugging or the pulling at the ears, again, increased fussiness and crying, having trouble sleeping. And again, a child, like a younger child, will still pull at their ears. Doesn't have to be, an older child, but an infant can still pull at their ears. Again, having a fever, if there's fluid that's draining from the ear, again, if that was, that would be problematic, but that would be another one. Clumsiness or problems with balance where they can't stand up straight, or trouble hearing or responding to quiet sounds. Again, I agree that these are not anything to mess with, and I don't want to sit there and tell parents that they shouldn't go and be seen by their pediatrician, because I think that they should. But I think that that's something that could be an extra thing that you could do on top of that. And you can talk to your pediatrician about that. Some of them might be open to it, some of them might not be. But if you're talking about doing the surgery in order to put a tube in the ear in order to dry out the ears, then maybe, like, what would be the harm of trying to get adjusted a couple of times at the chiropractor's office? Again, kids don't need typically a lot. So for one example, I had a mom, again, like I said, I don't push this on my patients. So I don't tell all my patients that they need to bring their kids into the office. But I had one mom, this is a few years ago, that she had her kid come in. She brought her kid into the office because she had had an ear infection. And the kid had slept like a total of 4 hours over the past couple of days. So the kid was exhausted. She was, at her wit's end. The mom was at her wit's end. The kid was not happy with anything. And, we go through, I showed the child, like, I adjusted the mom, and I showed the child, again, you're talking about, she was like maybe 3 years old, and I adjusted her, and she wasn't super happy about it. But the mom called me the next morning and was singing my praises because the child slept for 12 hours at the night. When I adjusted her, she slept for 12 hours that night and didn't wake up until the next day. I adjusted the child 3 times, and she had tubes in her ears. She had all kinds of other kinds of things, but we adjusted her 3 times and she didn't have another ear infection. And it was one of those kind of things, to go from having repeated ear infections over and over and over again, having the surgery, having the tube placed in the ear, and continuing to have ear infections despite having the tube, which is supposed to stop it. That's really, really cool. It's really cool to be able to help her, because, again, repeated ear infections over and over again can cause problems with hearing. Again, long-term problems with hearing and speech and other kinds of stuff like that. So there's multiple different reasons to want to try to get that corrected as efficiently as you can. So again, it's one of the options. Parents have a lot of different stuff that's there. I'm not saying that that you get your kid that you need to take them to a chiropractor right away, but that should be something that's kind of maybe in the back of your mind. So when it comes to trauma, kids get hurt, obviously. Again, one of the most common reasons for a kid in order to have them go to a chiropractor is that they had some kind of physical trauma for some kind of injury. Again, it could be a spinal misalignment. It could be something in an extremity. It may not always be an immediate pain or symptom, but falling down is one of those things that kids do. So children's chiropractic care, we try to take a holistic approach. There are multiple different things that show that chiropractic care is beneficial. So there was a study in the Journal of Chiropractic Research and Clinical Investigation that it concluded that athletes who received 12 weeks of chiropractic care exhibited 30% improvement in reaction time versus a group that didn't have any chiropractic care at all. And when it comes to the statistics, again, this is talking about the number of kids who play sports, right? So when it comes to kids, again, organized sports, again, you're talking over 36 million kids are playing organized sports a year. And the percentage of parents who are worried about the child getting an injury is around 87%. The percentage of kids who play sports outside of school is 60%. The percentage of boys that play organized sports is 66%. Girls is around 52%. So it ends up having all of these different things with more than 3.5 million kids that are under the age of 14, getting hurt annually playing these different sports. And again, there's all kinds of different reasons for it. Again, it just happens because, there can be lack of coordination on the kids, again, not knowing the rules, having multiple different problems. But again, more than 775,000 of those kids end up going to the emergency room. For these sports related injuries. And again, most of the injuries are going to happen because of falls or being struck by an object or having some kind of a collision or an overexertion during a sports activity. And again, what it comes down to though is that more than half of those sports injuries end up being preventable. So overuse injuries are going to be responsible for nearly half of all sports injuries to middle and high school students. So there's ways that you can try to figure out whether or not a kid could get injured. There are screening types of things like the functional movement screen that you can do on children, and, like, again, high school children in order to help to make sure that they are moving properly, that they have the right range of motion. There's, like I said, there's the functional movement screen. That's something that's typically done more by, personal trainers and stuff like that. I'm certified in the selective functional movement assessment, which is something that is a little bit more in depth in order to find out all of the little areas where somebody might not have normal types of motion or normal types of, again, whether or not it's range of motion or whether or not it's a fluid movement or however, where you might be able to correct some of the issues in order to make sure that they can actually fix it so that they don't get injured. So again, younger athletes are going to be more susceptible to overuse injuries because they don't have as great of reaction times and they're less coordinated. They're still growing and developing, again, especially in comparison to adults for all of that. And again, they also don't have the strength to be able to react as well as what they should. So again, there's multiple different things that can have a negative effect on a person's spine. So one of the other things that, like I said, and like I've mentioned here, is that I have a specialty in sports medicine. So, I'm a certified chiropractic sports physician. That's one of the things that I have. But I'm also unique in the fact that I'm also that board certified functional neurologist. So part of that, and not only having the specialized training, and again, in neurobehavioral disorders, but I also have some specialized training when it comes to concussion, and especially treating issues like post-concussion syndrome. So, the picture that's on here, the one that's to the left, is an article that has me helping treat a child who was hit in the head with a baseball and continued to play sports, even though his medical neurologist released him to be able to play. He was suffering when it came to his grades, when it came to behavior in school, and when it came to, continued symptoms that just kept presenting. But he was playing football. So it wasn't just like he got hit in the head with a baseball and then he was out. It was something that had been going on for years and years and years, and nobody knew how to help figure it out. It was one of the, or not nobody knew how to figure it out. Nobody knew how to help fix him. And it was one of the things that we were able to do was get him so that he no longer had those lasting effects of concussion. So, there's a whole handful of different things from this neurological stuff. And again, each of these could be its own lecture that we could do. But again, we can help people with head injuries, again, traumatic brain injuries, concussions, post-concussion syndrome that's been lasting for a while, issues with headaches or migraines, or people that might have, different things like Tourette's, or a cervical dystonia or a torticollis where the head is turned to the side. And again, those neurobehavioral disorders of childhood like ADHD, autism and autism spectrum disorders, and then dyslexia. So there's a handful of different things that we would be able to help somebody with. That is again, it's not all just adjustments. There's multiple different layers to it when it comes to a lot of those things. But again, there's a lot of stuff that can be done for patients. Again, still talking about sports injuries. Again, there's a major jump that you can end up getting in knee injuries, with kids, depending on, where they're being treated. Again, a number of young people that are diagnosed with a torn meniscus has been increasing recently. The number of injuries per year has been increasing. ACL tears have been, there's 11 cases more a year now than where they have, and again, that's, dealing with a specific population. So again, there's a whole bunch of things that you can do from the standpoint of rehabilitation. Again, this is my rehab room here, and where we end up having, different kind of things with weights and other kinds of stuff. I have kettlebells and other kinds of dumbbells, and we have treatment areas for people to actually do exercises, learn how to do exercises, and again, get better. And obviously, not only for kids, but for adults as well. But again, you can do some life-changing type of recommendations when it comes to treatment. Whether or not it's backing off and preventing overuse injuries because they're being overtrained. Because sometimes some of these coaches have the tendency to just grind their students down. Having issues with a student picking a single sport at too early of an age, and getting overuse injuries in regards to that. And basically just making sure that the children are not going to be playing through injuries when, again, the risk and reward really isn't there. It's one thing if it's, if you're a professional player and, you end up having, a major injury, but you might be able to actually play in the Super Bowl. That's going to be one thing versus, playing travel softball or whatever, right? So making sure that there is, the right kind of rest, that you're trying to mitigate any further damage and stopping the ligaments from failing, or, overuse injuries and preventing them from continuing to get worse. Again, so timeout is one of the major things that's there. And again, the timeout when it comes to, returning a player to play after concussion, for example. So one of the things that's important about me having that designation as a board certified functional neurologist is that I'm one of the few chiropractors in the state of Ohio that can actually return a youth athlete to play. There are certain rules and regulations that happen, and you have to have certain types of credentials as a chiropractor in order to return a child to play. Any medical doctor can return them to play just because of the ways that their license work, but you have to have special training as a chiropractor in order to be able to return a child to play, and that's one of the things that I can do. So it's trying to make sure that you are helping the child to obviously recover as much as they possibly can. So again, when it comes to sports injuries, again, there's obviously forceful impacts, repetitive motions. Again, there's treating the pain itself. There's, actually like trying to work on the ankle sprain. Again, there's a number of things that we can do in the office. Something that I use called Graston technique, something that I use called kinesiotaping, can all be things that can help to deal with the pain. Adjustments, spinal adjustments, or mobilization of the spine or mobilization of the joints, depending on what it's there. Again, in some cases, you're not going to be mobilizing a joint because it's already been moving too much and you don't want to damage it anymore. So it depends on the person. It depends on how the person was injured. It depends on the history and everything else. So it kind of, there are multiple different things that are there. So, and obviously ice, heat, electric stimulation, but we're also going to try to work on prevention. So you can help with girls, and there's women have women and younger female athletes. They all have a slightly higher risk of having something called basically having the female triad, which you can end up having. There's a couple of versions of the female triad, but basically tearing the medial meniscus, the ACL, and the LCL all together is something that has the tendency to happen more in female athletes than it does in male athletes. But there are ACL programs that you can actually do that when you put the women through that, their likelihood of having an ACL tear and having that triad happen ends up going way down. So there's a couple of different things that goes on from there. This is, we're almost done here. So when it comes down to it, is that one of the big things that ends up being an issue is headaches. Headaches end up being a huge issue among school kids. So among kids that are around 12 to 15 years old, somewhere between 66 to 71% of them have a headache, every 3 months, which isn't necessarily that big of a number. Like, it's a big number, but having one headache every 3 months isn't that big of a deal. But 33 to 40% of kids that are 12 to 15 have a headache at least once a week. That is a big deal. That's a huge deal. And those headaches are a lot of times, they're accompanied by other types of emotional or physical manifestations. So for example, in adolescent girls, 29% have headaches week to week. And again, this is according to one study. So one study says that 33 to 40% have at least one headache a week. A separate study talks about how basically 30% of adolescent girls have headaches, at least one headache per week. So 23.6% of those same girls have back pain more than once a week. And when they end up having one of those, the likelihood that they end up having both or adding on top of it morning fatigue, where 30.6% of them have morning fatigue, or stomach aches, where 20.7% end up having issues with stomach aches. So if you end up having, a child that ends up complaining of stomach aches, right, then the likelihood that they end up having something like headaches or low back pain or this morning fatigue kind of stuff ends up going through the roof. And if you can do something that end up helping to affect the amount of pain that they're having, you can also affect the other ones. So by helping a kid that might be having this morning fatigue, they might have headaches, but again, kids don't necessarily know that this is not normal, right? You know what's normal, like at least most patients do. I ask most patients when they come in whether or not they have headaches, when I have them mark it off on the box. And if they don't mark it off and I ask, do you ever have headaches? You'd be surprised at the number of patients that have said, well, I mean, other than my normal headache, I don't have headaches. What do you mean your normal headache? You shouldn't have headaches on a regular basis. So, sometimes people's version of normal gets skewed, but kids a lot of times don't know what it's like. So like, for example, like when we go on hikes in national parks. When we were going on a hike in a national park and we were headed uphill, and my daughter was not necessarily so happy because she was saying that her legs hurt. And we're like, what do you mean? And then when we figured out that what she was talking about was like the slight burn from using them, she was like, and we explained to her that that was normal. She was like, oh, and then she took off and she, kept going. And she did a lot of miles on those hikes. But again, kids don't necessarily know that headaches aren't normal or that back pain isn't normal. So they might not complain about a headache, they might not complain about the back pain, but they might complain about the stomach aches. Or when it comes to the morning fatigue, you might be complaining about that. So those would be some things that you could actually ask a child to see whether or not they're having some of these other kinds of things, because if you can help with the headaches go away, if you can help with low back pain or the upper back pain go away, then you might be able to help with the stomach aches or help with the morning fatigue or other kinds of stuff. So the prevalence gets higher when kids get older. So, as a child ages, the likelihood that they're going to have a problem is going to increase. But the thing to kind of pay attention to is that, again, if a kid is having headaches on a regular basis, that is going to decrease their quality of life. Again, it has a negative influence on how well they do in school, on how often they're absent from school. And again, those are linked to emotional and physical difficulties. So you can end up having all kinds of issues with that. They end up being linked often to depression and anxiety. They get linked to musculoskeletal pain, other types of pain in other areas. Obesity. Again, a kid that doesn't feel good isn't going to be moving very much. Asthma. again, can be linked to it. Again, we already talked about how asthma might be able to be helped. So again, headaches are this multifactorial type of disorder that can end up being helped by chiropractic care. So, and again, there's so many different things that can be related to it. So again, having chiropractic care can definitely be of benefit to children. So that's the basically the end of the lecture. I just wanted to thank you for sitting through the class here and listening to me talk about all this. Definitely appreciate this. We love sharing topics with people who are eager to transform. Again, trying to get your family's health back in line. I would like to say that we like to get your family's health back into harmony. And if you have any questions, we would be more than happy to answer your questions. You can obviously give our office a call. You can schedule, make an appointment. Um, if there's any questions, you can post your comments and your questions below. And I'd love to be, like I said, I'd love to be able to help you on your journey in order to help make sure that your kids are as pain-free as they possibly can be, and that they're as healthy as they possibly can be. So thank you very much, and I will maybe see you guys later. Thanks. Bye.